Mic check good? Yeah, no. Hello. Yeah, this side. Yeah, and I'll let her know. Yeah, someone else is gonna have to do that.
Okay. When did you do a mic check? We'll do that too.
Mic check, 1 2 1 2. Mic check, 1 2 3 4. 1 2 3 4. Everyone good? All right.
I got last night and I got the lieutenant.
Unflown. Flown. Within it. Yeah, that's fine.
Oh, sure. Yeah.
Mark, sorry, can you tape this down? I just know Jake's gonna see it.
Yeah.
He's gonna be annoyed. I apologize. So, Senator
Yep.
Spain been targeted.
Right.
Mine is white with a red stripe. Got a red cockpit. It's got the modern rudder on it, not the crummy one that falls off all the time.
You guys want to vote? We're selling.
Tiller extension.
I get 10% of his commission.
Well, give her what he says. We might not
Jamie this morning.
Good, how are you?
Not too bad.
He's selling too, though, so I got to start the vote sale.
Here you go. Take a picture of this. It's got my home phone on it.
This is inside yesterday, that ribbon cutting outside for like over an hour.
I'll deliver it.
I was like, I can't use this. This is rough.
Terrible, I'm sure.
When you reach me,
Yeah, you can send me pictures of that.
I'll probably be done with it by end of August, early September.
Okay. Oh, well, that's a bummer.
Well, it depends how many dates he takes out on the boat.
Well, if I fall in love with that. Since they fell in love with it. I know. Not saying you should, I'm just saying it's a possibility, it's 2020.
Anything can happen in 2020.
That's right.
Yeah.
If she can just move it just a little bit this way, it'd be great.
You got me 16.
Well, and this is Deb's mark right here, correct?
Yeah.
Left foot on it.
What if you were able to step back a couple feet, or is that not allowed? Because optically, that lets us get a little tighter.
Yeah. You can
I'm not saying all the way to the wall, but
That's someone else's mark.
Yeah,
I mean,
no.
she's just making sure it's 6 feet from them.
That's fine.
even that little move there just helped me a lot.
No, that's fine. Okay, so 1, 2, 3, 4, 6.
I'm good on my end with this shot. Are you guys good with your shots with Deb beating those two for a second? I have everything. I have this, I know, yeah.
I'm not worried about trimming, it's just,
My pod, yeah, yep.
So no, they should do it on the whole deck. We're not, usually they make that for me.
On the slack left in it.
I know. My other extension cord just died like last week too.
They said, let's change it.
Terrible timing. Yeah, it worked.
I would just wrap it, so it doesn't pop.
Hey Tony, if you're gonna mess with that, would you just unplug it and get it on the other side of the brake cable? It'll be a little less,
Yes, I will do that. Can I unplug that real
Yeah.
quick? Because we're gonna try to not pull on that.
Sure.
Yes, thank you.
Is it just pull?
Not like.
Yep, it doesn't pop right apart.
Now we'll put that thing under the counter, and we will make sure the seat is tight. And
I
that's
know,
good.
it's just-
Yep, and I'll put the tape on.
Just so it doesn't come in.
Yeah.
we have these jacks over here that are.
I know.
Hey, I forgot.
There are some mini jacks on the box you could try.
Okay.
You wanna try that?
Will that work too?
In theory,
Try
yes,
it right
it's
there,
very
Tony,
possible.
where it connects there.
And we'll plug it in and see if we hear it. Then you won't have to worry about that, and it'll be nice
That
and
would be
clean.
great. That would be
Yeah,
great.
leave everything else in, so we can go back to it.
Yeah.
It doesn't work.
Hardly anymore.
So each one of these has a little plug here.
Let's go to this one.
Oh, no.
Nope.
You know,
That won't work. It has to be the other end.
End of
It
it.
has to be the main.
Okay.
So it probably won't work.
Okay, thanks. Thank you for
Mike
checking.
has the
They
main one
kind of called time after that.
that she has. So she's just extending it and it goes.
yeah. That Radio Shack's gone, because everybody should have one of those
Right.
connectors. if you know
Yeah.
what they're doing.
It's easier to use. Yeah. Okay, yeah, but like you, you're just saying everything right. Yeah, ours slipping, and then of course, last night everyone put their things, like the clothes were for Yeah, so pretty much like we have to use, like the police reporter had to send a question, I'm like, I can only ask like so many. Yeah, like I don't have this much time.
Hey Siri, call Darren.
We like to use together.
Turn
You
the
know, one or
phones,
two
everybody.
sometimes, yeah.
I'm on it. Calling Darren Urban Mobile.
You see, you hear me okay? There's a lot of attached underneath mine because they.
Oh yeah, that was this morning, they all around.
Imagine that.
It is not. So everything's good. She's gonna be camera ready. I asked her to move back like 2 feet, which lets me zoom in just a little bit more. All right, message me back afterwards if you need something.
When they're ready.
Okay, bye.
Were you bored?
total fair experience. You go get a cozy dog, then you drive over to Knights Action Park and get on a Ferris wheel. You go over to Bun and dodge the golf carts. And I think that's your complete experience.
Yeah, just repeat each other.
Go to
And
Hot
thanking
Market,
each other for
do it.
giving them the time to speak.
Over an hour plus comments, teacher comments.
Now there is gonna be
Did they do like a little
a
march
miniature
before?
one-day kind of thing at the fair.
That's what it's
For
saying.
the 4-H'ers.
Yeah, I heard.
They're gonna parade them in one end, boom, out the other.
That's really cool. I would like to hear a speech actually from you.
I mean, we were all just talking about how great Stacy Peterson is, and you walk in, we can't have you here in that.
I can't hear it.
I'd be happy to give a speech. I did a lot of community theater in high school.
I would love to recreate some of those memories.
You'd be impressed.
I know I would.
Yeah, exactly.
You could travel and kind of lighten the mood for everybody.
Like, hey guys, you never know. I could do it.
Do that. How y'all doing tonight? Like 6 in the morning.
Was in Peoria all the way?
Although I think you
Oh, I'm sorry. That's way out of rush.
Yeah.
Do some.
Oh wait, that's Walter Needy.
We have fun together, guys, don't we?
You actually sit there and like watch a crowd and how the volume goes down, like you drops really quick.
Well, good morning, everyone. A special thank you to Monica Hendrickson and the staff of the Peoria County Health Department for hosting us today, and maybe more importantly, for working to see Greater Peoria through this past several months as safely as possible. It's truly great to be back in Peoria, and I'm also grateful to Mayor Jim Ardis and County Board Chair Andrew Rand, Leader Dave Kaler, Representative Ryan Spain for welcoming me here again today. I'm here because the most impactful change starts locally. I'll be frank, we need to see some change here in the Peoria area when it comes to the COVID-19 pandemic. As much as I'd like to, this virus isn't something that we can wish away. So we have to act responsibly and collectively to protect the people that we love. To date, relative to most other states, Illinois has seen real success in handling this pandemic. But it doesn't take long to see that trajectory of success turn around. And right now, things are not heading in the right direction. As of Wednesday, our current statewide 7-day rolling positivity rate is 3.8%. Here in Region 2, which includes Peoria, that rate is 4.3%, with 7 days straight of increases and 3 days of increases in hospital admissions. And I'll remind everyone that the health metrics that we set for a return to tougher mitigations is 7 out of 10 days of increasing positivity rate plus a sustained 7-day increase in hospital admissions. So if this region has 4 more days of people getting sicker and needing a hospital bed, that means bars will close again, and a possible reduction of service at restaurants, and smaller capacity limits on other activities. The specifics of the reversal will be determined and dependent upon the types of activities that are most likely causing or could cause greater community spread of the virus. As updated recently, we have 11 regions in our Restore Illinois plan, most of which are inching up on several metrics. Peoria is just one of 4 counties out of 102 that is now on the warning level by the state's Department of Public Health, because you have an increasing level of emergency department visits related to COVID-19 and increasing numbers of new cases. Much of the increase in cases has been tied to the 29 and under population, large social gatherings, and also household spread from family member to family member. I was pleased to see that Monica Hendrickson and her team of public health professionals issued new advisories and increased visual mitigation reminders recently as Peoria has seen dangerous rises in its health metrics. The Peoria Public Health Department and IDPH both have the same goal here and are working together toward that goal, and it's keeping the people of Peoria and all of Illinois safe. With a situation like this, it's critical for local leaders and residents alike to constantly evaluate the situation on the ground at a more granular level. That's why we've provided you with local information about the spread of COVID-19 in every county on the IDPH website at dph.illinois.gov/county metrics. I'm going to repeat that for anybody listening in who wants to write it down, dph.illinois.gov/county metrics. And you can also find this data on your local public health department website. Believe me, I know firsthand that these decisions are difficult. Often it's a choice between something bad and something worse. But I also know that local action can be much more surgical, like in Sangamon County, which is stepping up to more proactively enforce bar and restaurant capacity limits. Taking early action will protect community health and save jobs in the long run. And just as importantly, each of us has to take responsibility too. I want to urge Peorians to follow the mitigations more rigorously. Wear a mask everywhere you go in public. Do not enter a bar or restaurant or any enclosed space if it looks crowded. And keep 6 feet of physical distance. Wearing a mask is like wearing a seatbelt. It's required. and it saves lives. Another thing you can do, if the Peoria Health Department calls you, please answer your phone. They are likely calling to do contact tracing, which will help us slow or even stop the spread of COVID-19. Contact tracers are calling to let you know if you've been exposed to someone who tested positive, to tell you where you can get tested, and will give you valuable information that will keep you and your family healthy. Folks, this virus is extraordinarily serious. In other parts of the country, people are dying at alarming rates. Infections are rising in the South and the West, in every one of our neighboring states, and right here in central Illinois. 150,000 people have died in the United States in just 4 months, about a third of a year. This is our moment to pull together, to protect the progress that Illinois has made since the beginning of this pandemic, and to keep our families, our friends, and our neighbors healthy and safe. Thank you, and now I'd like to turn it over to Illinois' own leader of our Department of Public Health, Dr. Ngozi Ezike. Doctor?
Thank you, of course, to you, Governor, and good morning, everyone. I want to thank Monica Hendrickson, the Peoria City County Health Department Administrator, for hosting us here today, along with our local leadership. This is a very challenging and important time. In addition to all the healthcare workers and providers, the local health departments are also on the front lines working to keep communities healthy and save lives. Doing what needs to be done to keep people safe doesn't always win you popularity contests, but it's still the right thing to do. I have talked to friends who've said that they felt, since no one else was wearing a mask, they felt uncomfortable putting on theirs. If adults can't overcome the peer pressure to wear the mask, I'm not sure what we expect from our kids, so we have to set the right example. We know that keeping our distance from other people helps reduce the risk of exposure. Similarly, wearing a face covering helps reduce the risk of spreading the virus when someone is unknowingly infected. The clear trend in our state and in the country is that we are moving towards universal mask wearing. So thank you for everyone who has already adopted these measures. We are not tone deaf to the struggles that people are facing and the desire to just get back to normal. But we ask you to be as safe as possible as we learn to coexist with COVID. Right now, restaurants and businesses are open with limited capacity. Some recreational activities are resuming with measures in place to reduce exposure and spread. There is nothing that can completely eliminate risk. People are returning to work, but with that, as we see more cases across Illinois, it just highlights our need for these important mitigation measures. We are seeing hotspots, as the governor mentioned, not only in the numbers of new cases, but also in the numbers of admissions to our hospitals. So we're trying to do all that we can so that we can keep businesses going, but there may be a point where we reach a certain threshold where we have to reduce capacity again temporarily. Maybe restaurants will have to go back to takeout. But we can avert this with our individual action. I know that changing behavior is hard. Maybe other communities and other countries and other continents had already this culture of using masking. So we're adopting something new and we're getting it. We will start to wear our face coverings as we gather. We will avoid crowding into bars and stores. We know how critical it is. We've seen it work in other places, and we're going to have that same positive effect as we continue its uptake. I know we're tired of hearing it, but it's still the same three things. Wash our hands, wear our face coverings, and watch our distance. In mid-May, we reported more than 4,000 cases in a single 24-hour period, and 191 deaths over a 24-hour period at our peak. Yesterday's numbers gave us 1,400 new cases and 18 deaths in a 24-hour period. We want to not reverse our progress. We know what it takes to slow the spread. We're learning how to do it. We're going to take it up quickly and be part of the solution, not the problem. Thank you for everyone's continued support in this important measure. And now a brief summary of comments for our Spanish-speaking population. Quiero darle gracias a Mónica Hendrickson por tenernos hoy aquí y por su liderazgo del Departamento de Salud durante estos tiempos tan importantes y retadores. Además de todos los trabajadores y proveedores médicos, son los departamentos de salud quienes están en primera línea para mantener nuestras comunidades sanas y salvar vidas. Hacer lo necesario para mantener a la comunidad sana no siempre es lo más popular, pero es lo correcto. Sabemos que mantener distancia entre nosotros reduce el riesgo de exposición. Similarmente, usar mascarilla reduce el riesgo de compartir el virus cuando una persona está infectada sin saberlo. Sin embargo, entendemos que cuesta esfuerzo y que se desea regresar a lo normal. Pero les pedimos que tengan cuidado lo más posible mientras aprendemos a coexistir con COVID-19. Ahora los restaurantes y negocios están abiertos con capacidades limitadas. Algunas actividades de recreo han abierto de nuevo con ciertas medidas para reducir exposición y contagio. Y la gente está regresando a trabajar. También estamos notando lugares donde hay concentraciones de casos nuevos y donde las visitas a las salas de emergencia por personas con síntomas de COVID-19 está aumentando. Esto indica que vamos por el camino equivocado y debemos actuar ahora mismo. Tal vez esto significa que los negocios necesitan reducir su capacidad aún más o que los restaurantes vuelvan a servir su comida solamente afuera. Pero también significa que los individuos debemos tomar acción y responsabilidad. No tengan eventos o reuniones grandes. Cuando necesita salir, cúbrase la cara y mantenga su distancia de los demás. Todos estamos cansados de oír estos consejos, pero esto es lo que funciona. Sin embargo, solo funciona para reducir la propagación y casos nuevos de COVID-19 si todo lo hacemos. A mediados de mayo reportamos más de 4,000 casos dentro de un periodo de solamente 24 horas y 191 muertos en su pico. Comparemos eso con ayer, que reportamos un poco menos de 1,400 casos nuevos y 18 muertes. No regresemos a reportar más de 4,000 casos y casi 200 muertes en un solo día. Ya sabemos lo que reduce el contagio. Sea parte de la solución y no del problema. Por favor, mantenga su distancia, usa mascarilla y lávese las manos. Muchísimas gracias. And with that, I will turn it over to Monica Hendrickson.
Thank you, Dr. Ezike. On behalf of the Peoria County Board of Health, as well as the Peoria County Board, I'd like to welcome you all. To date, the numbers in Peoria County sit at 1,176 cases. And while 63% of our cases are considered recovered, we've seen in recent weeks those that are at home isolating, as well as those that are hospitalized, continue to grow. Throughout the response, Peoria City County Health Department has been monitoring our community closely. And recently, our data shows that our positivity rate has doubled in the past 2 weeks, that our 7-day average in terms of cases each day has climbed 14 cases in 1 week, where we average 33 new cases each day in Peoria County, as well as our ICU and med-surg capacity is on the incline. Last week, along with Adams County, LaSalle County, and Randolph County, Peoria County transitioned into the orange level, indicating an increased risk based on the 8 metrics identified by the Illinois Department of Public Health. With that, I issued a health advisory, which not only outlined what our data was showing, the high-risk groups of 20 to 29-year-olds, the large gatherings, and the precautions in regards to social distancing and face coverings not being followed. But it also included what we needed to do to change our trajectory as a community. This response has shown 4 things. The first is that this virus, as it is novel, it is an equal opportunity virus. And without a vaccine or extensive medical treatment, we're going to be relying on our first and best defense, and that is social distancing and face coverings. Second, as public health locals that are responding to this day in to day out, we have an ally in the leadership of Dr. Ezike. Third, that as a state, we have been responding by using data and science to drive our decision. And this early approach has been harnessed and directed by our governor, and we appreciate that as a science-based entity. And then lastly, in Peoria County, we were able to mobilize quickly and start responding. We were able to feed thousands of children when school closed quickly. We were able to get test sites and access to care quickly. PPE, mental health services, doing testing at our congregate living settings and our homeless capacities. Peoria County has the ability to mobilize and respond quickly. So as we move forward, we need to rely on that ability to do so. And one of our leaders that we have here locally to assist with that is Senator Dave Kaler. Senator.
Thank you, Monica. Thank you, Governor. Thank you, Dr. Ezike, for all that you do to keep us safe in Illinois. Governor, you mentioned that we are about to turn a corner in the wrong way. But I do thank you, because every night when we see what's going on across the country, we're thankful in Illinois that you have been just vigilant at keeping us safe. And even though our numbers are going up, we're hopefully going to try to turn that around. A couple things that I want to point out, just in being about the community and watching what's going on. First of all, people have to learn how to wear masks. This is not wearing a mask. And you see that all over the place. And I hear more and more comments about that from the public, is that, you got to put this up over your nose. I mean, that's what it is to be safe. If you sneeze and it's on your chin, it doesn't do anybody any good. Secondly, I want to tell you, yesterday I met with 2 businesses. One was a bar and restaurant, one was a grocery store. And I'm kind of alarmed at hearing this, but both of these establishments ask for patrons to wear masks when they come through the door. They have reported that their employees have just been brutalized by some members of the public who think that it's, their right not to wear a mask. But you have to understand that these are businesses that are trying to protect the public, trying to protect their employees, and they need our help. And I'll remind people that we passed a law in the legislature this spring, signed by the governor, thank you, that increased the penalties if someone who is an essential worker or frontline worker is assaulted by the public. We have to take this seriously. So it's now our part. We know what the governor has done to keep us safe, and we know what our agencies at the state level and the local level have done. Now it's our part. If we want to turn this around, then we have to do our part. And the first and most simple thing is just wear a mask and keep your distance. I want to now turn the podium over to Representative Brian Spain.
Well, thank you, Senator Kaler. And let me start first by thanking our public health leaders here locally and for the state of Illinois. Dr. Ezike, thank you for your great leadership for the last several months throughout the pandemic. Welcome to Peoria. Thanks for your tireless efforts. And I want to especially recognize our Director of Public Health, Monica Hendrickson. Monica has been really the leading voice for mitigation in our area throughout the state. Director Hendrickson has been one of the key architects on how we can begin to reopen our economy safely, and I couldn't be more proud to have our public health director doing such an outstanding job here in Peoria. So Director Hendrickson, thank you. And then lastly, Governor Pritzker, thank you for being here in Peoria. We're used to welcoming the governor to town on very happy occasions. We're announcing new investments in infrastructure or kicking off some major economic development initiative. That's not the visit today. This isn't a wellness visit. This is a serious occasion, and it's very serious, and it's very important that the governor is here to reinforce this message. And I'm happy to be here representing a message of bipartisanship. Public health is not a partisan issue. This is not a time for any of us to retreat to our corners, even though we're approaching an election. This is not a time for Democrats and Republicans to do battle against each other on the topic of public health. We need to take this very seriously. We need to listen to the advice and recommendations of our public health officials. We need to wear our face coverings, keep our social distance, avoid large gatherings. And here's what's at stake. We have gone through a lot as a community and as a state, and we have begun the process to slowly initiate our economic recovery. Do not make the mistakes that set us backward. We can't afford to go backwards. It will be agonizing for our businesses that still continue to struggle. So this is a message to implore the help of everyone. Our economic recovery is at stake. The reopening of our schools are at stake. The education of our children is at stake. We need compliance. We need your help. Everyone who is listening, Republicans, Democrats, independents, old people, young people, the millennials. I'm a millennial myself. We are not invincible. We need to take this message very seriously, and everyone needs to do our part to work together as a community and work to beat this very serious public health challenge. Last up, I will now introduce our final speaker, which is our Mayor of Peoria, Jim Ardis. Mayor?
Thank you. And I also would like to, and already have, welcome the governor here today. Governor is no stranger to our community, and we thank him for that. And again, it's all been said. A lot of the thank yous have been put out there, a lot of the reasons that we're here today, but at the end of the day, it's really simple. We're on the verge of stepping back, and that is not what we need. Our businesses need to be open. They need more business. Taking a step right now is very likely to be the end of a lot of our small businesses. They can't take it. I would kind of equate this to a different crime that people say, if you see something, say something. If you see somebody without a mask, say something to them. You don't have to be rude about it, but bring it to their attention. People need to know how serious this is. The governor is not here to issue a threat. It's reality. It's the metrics, and if the numbers put us in a bad spot, we're going to go back. So I appeal to everyone out there to please take this seriously. Please do not potentially put more small businesses out of business, and abide by the mandates to wear a mask and to be safe. With that, I would like to invite the governor back for Q&A. Governor.
Thank you, Mr. Mayor. Happy to take any questions from members of the media.
Can we quantify exactly how close we are to, putting new restrictions on? We've heard for the last couple of weeks that, it's coming, we might have to pull back on certain things, but can we make this realer for members of the public? I mean, is it a week? Is it 2 weeks?
Well, as I said a little earlier, we've had 4 days in a row where we've had hospitalizations going up. That's in addition to 7 days in a row of cases going up. And our positivity rate, not just cases, but positivity rate going up. Those are two things that, working together, if we have 7 days of hospitalizations going up and 7 days of positivity rate going up, we are going to have to move this region backward. And that is not something any of us want to do. And so, we've been making this call out to people to wear masks, to do the right thing, to follow the mitigations. I'm here today to re-emphasize that. And I know that everybody standing here today believes strongly that if the public will act, we can prevent this region from moving backward. But it is critically important that people listen today, that they understand that essentially this is, we're heading into a very, very difficult time when the rest of the state is also struggling. When even though we are much better off than all of our neighbors in terms of our positivity rates, in terms of our hospitalization rates, we're heading in the wrong direction because some of our surrounding states are causing a little bit of that. And then add to that, we have a national crisis. You see it in the South and the West. You get it reported every day on your television sets about Florida and California and Texas and Alabama and so on. And, you know, this is a difficult time. We can do this in Illinois. We did this better than almost any other state. And we really remember, we were at a 23% positivity rate at one time. We had a day when we lost 192 lives. I will never forget that day. I find it hard to forget any of these days, the numbers that I look at in the morning about the number of deaths. I'm telling you, we can defeat this thing in Illinois or do better than the other states because our people are just better at this. We've proven that. But I need everybody to react to what we're saying here today by wearing your mask, by keeping social distance, by washing your hands.
So we see these trends in our 3 days, then we're talking about new restrictions.
That's right. If there are 3 days, additional days of increased hospitalizations. By the way, these metrics have been published on our IDPH website. You can find all of this information for yourselves. You could track it for yourselves. I hope people will. I hope that listeners here aren't just thinking about Peoria. Those who are in Peoria certainly should be thinking about Peoria, but everybody in this region, indeed across the state, should be looking at those metrics, seeing how their region is doing, and asking their public officials, like the ones who are around me today, their local public officials, to make sure they're putting mitigations in that will help keep the region from moving backward.
So you're saying 3 more days here in Peoria County, if we have rising hospitalizations for 3 more days, we're going to see
across the region. You happen to have some great hospitals here too, but it's across the region. It's the rising number of hospitalizations across the region.
So it's the whole region.
It is, but Peoria is also one of the most populous areas in the region.
Right, right. So, I mean, but our numbers are rising, but they're being diluted by all these other counties
There.
and are in this big region. So we're not necessarily 3 days from restaurants closing and that sort of thing.
Not necessarily, but again, the entire region is 3 days away. I mean, if something happens in another, look, you know, I wish we could all say that, well, you could protect yourself in your county alone. Can't do it. It's why we needed a national policy, by the way, to deal with COVID-19 and never got one. But you know, the idea that all the states around us, for example, have higher positivity rates, some of them twice and 3 times the positivity rates that we have in Illinois. I wish we could, you know, just manage what we have in Illinois. The truth is the same thing goes for counties. It's not just about Peoria. People leave Peoria County, go to the next county over, come back. People are driving all about the area. It's one of the reasons why we divided the state into regions and not just county by county. Dr. Ezike, do you have anything to add? I don't want to.
I think it's really helpful to understand that there are things that we can do. I mean, people who are admitted to the hospital, we can't really change that. If somebody's going to get sick and go into the hospital, that illness has happened, they need to seek care. What we can change are the metrics around the positivity. And so people masking so that they don't get themselves exposed or expose someone else, that is going to drive down the positivity. So there are things within our control. An individual probably can't decrease the amount of capacity in our hospitals, but we can help prevent ourselves infecting someone else or getting infected ourselves by making some great choices. And so I want us to focus on what we can do, because there's some things we can't change, but there are things that are completely within our control.
And a question that we received, someone wondering, do you have the authority to shut down or place these restrictions as the court ruled that it was unconstitutional?
No court has, you know, we have that ability here. You know, there are people who are suing to try to make it, to remove all of the restrictions that we've put in place. That has not been effective. There's been one lawsuit in one county where one judge ruled on behalf of the one plaintiff. And, you know, they're continuing with that lawsuit and then trying to expand it all across the state. But the truth is that we have the ability under 2 different acts in the state of Illinois. I have the ability to issue a disaster declaration for the state. And when you have an ongoing disaster, an ongoing pandemic, like we do. This sometimes has occurred in the past with floods. Floods don't just decide after 30 days that they're done flooding. And so governors in the past have had to issue successive declarations of disasters, and that's what we've had to do here. I mean, I don't think anybody can dispute the fact that this pandemic is still among us. We do not have the treatment or the vaccine that will stop this thing, and unfortunately, it's now growing again in the state of Illinois. So we're going to deal with it. We have issued the orders to do that. We have a masking requirement in the state of Illinois. We need local officials to enforce that. It's especially helpful if we maintain our capacity limits in bars and restaurants and any really gathering place where people are speaking in close quarters with one another, singing, shouting. Those are all things that can happen in bars more frequently because people aren't wearing masks naturally if you're drinking in a bar. But so I caution everybody, please wear your mask. Please do not crowd into an area with a lot of people in it. Respect people and distance, and do your best to encourage others to do the same.
Governor, could you explain why the two officials that oversaw the COVID-19 response in the nursing homes were replaced at IDPH, and when will senior advocates be able to make unscheduled visits to nursing homes?
Well, let me start with, we don't discuss employment matters like this. The information will be, available as it comes forward under the normal processes in state government. We're very much on top of the nursing homes and the situation in nursing homes. Look, this has been a terrible tragedy all across the nation, that in nursing homes that we have gathered together in nursing homes some of the most vulnerable people who are more likely than not to either get COVID-19 or to have serious complications or death from COVID-19. And this has been, a terrible tragedy everywhere, and in Illinois, where we have more, on a per capita basis, more nursing homes than most other states. So we are, we're focused on our long-term care facilities, continue to be so. And you're talking about advocates coming in. Remember that very early on here, we closed down our nursing homes to outside visitors, which is a very difficult thing to do. Families obviously want to be there with their loved ones, and their loved ones who are in nursing homes want their families to visit. But what we didn't want is for COVID-19 to be traipsing in the door every time somebody comes to visit, because that's possible. Asymptomatic people, family members, children, adults, who are visiting their seniors, their grandparents, can bring it to them. So we closed that down. This is early March, before we had a stay-at-home order, weeks before, in fact. And we began health checks of everybody working in nursing homes. So we're being extraordinarily careful even now about letting people come in and out of a nursing home. Even deliveries are difficult to do because we don't want the truck drivers and other people who are bringing goods to a nursing home to, again, go in and give it to somebody inside the facility. So I realize that everybody would like to have advocates and others, and just frankly, they'd like to have all their friends and family visiting, but we're going to have to continue to be extraordinarily careful going forward.
Governor, hypothetically.
I just want to, sorry, you had a question.
Well, I was just going to say, going back to our younger population, we're 2 or 3 weeks away from kids going back to school.
Yeah.
We might be reverting backwards. What do you say to the school districts who are starting on day one with 5 days a week in person, and what happens if teachers strike?
Look, every school district, every school, in fact, within a school district, within a, an area, has to make decisions for themselves. We've set some pretty good guidelines for people. Everybody wear a mask. That's very important. Making sure that people are keeping social distance and keeping capacity limits within the school. Those are among the very basic and required parts of our proposal, our guidelines for schools. But every school is built differently. Every campus on which a school sits is different. And so we really need local administrators as well as parents and school boards to be thinking about the circumstances of each school within their district. So that's what's happened across the state. We've encouraged every school district to make sure they have dual option. The opportunity for people to go in class, in person, and the opportunity to learn at home, because there are going to be people, kids, who are immunosuppressed or have somebody in their own home who's immunosuppressed. And what we don't want is to have transmission of the virus to people who are the most vulnerable. So again, all I would say is that wear the masks, make sure kids are wearing masks, make sure that you're doing everything you can to follow the guidelines that we've put forward and to keep everybody in our schools safe. And that includes the parents, many of whom visit, frequently to school, either picking up their child or going to meet with teachers.
And this will be our last question over here.
Yes, sir.
Hypothetically speaking, if we were moved back a phase, will we reset to the 28-day system again to go back to this phase?
That is likely that we would have a 28-day period in which we would look at, but it all depends on how quickly a region is moving in the right direction. And again, what we don't want is to have the state, any region in the state moving backward at this point. So that's why I'm here. I don't want everybody standing here, and frankly, everybody across the state. We do not want this state or any region in the state moving backward. So I'm imploring people to follow the guidelines, to follow the mitigations that we've put forward, do everything they can, and that way we won't have to move any region backward. But I would say that we're at a danger point, everybody. Pay attention. Now is the moment to wear your mask properly, as the leader said when he was up here, wear your mask properly. And for people who aren't wearing masks, please start now. It is never too late. Start now. Thank you very much.
Thank you, everyone.
Thank you, Governor.
Thank you. Thank you very much.
She was gonna try to